Oops. Morning, everyone. We wanted to do a quick Friday fact for you, just a couple minutes. So we're going to give it a couple of seconds, see if anyone jumps on with any questions. Otherwise, we'll just roll on and do a quick video here on counseling versus medication and counseling and both and conjoined. So like I said, we'll get a few minutes, see y'all who jumps on. So far, we've got Siobhan. Good morning. So, please keep those suggestions for future discussions coming in. We've had several people message us with recommendations, things that we're planning, a couple of good ideas. So Siobhan's loving that we've gone live twice this week. We're going to try and do live twice a week. We're going to try and do our Fact Fridays, quick tips, and Tip Tuesdays. So again, not real long videos, just little tidbits here and there, things that you guys can think of, things that we can think of. So, all right, we'll go ahead and get started. Thank you everyone for watching and joining in. Like I said, we have had several comments. We appreciate them. So medication versus counseling, why can it not be both? I'm a big believer in medication. I personally did not want to become a psychiatrist and do just medication management all day long. I wanted to do more of the helping people daily lives aspect. So counseling is a really good fit for what I wanted to do. But I do believe in medication. I recommend medication to my patients all the time. We work with several doctors here in town with different insurance needs, whether you have insurance, whether you don't have insurance, whether it's Blue Cross, TRICARE, we take all those, but not all doctors do as well. So we work with several doctors, different specialties, so we can definitely be a resource even if we can't provide counseling for you. But as far as if you need medication, I believe that you should also have counseling. If it's reached the point where you need medication, then counseling is also important for you. Sometimes the issues can be just counseling based where we don't need medication. But if you have the medication, then counseling is definitely something you should be looking into as well. We have a culture today of quick fix, pop a pill, solve problems, which not only affects the addiction culture that we're facing right now as far as opioid crisis, but also affects just mental health. Sad, depressed, take this and you'll be okay. And there is some truth to that. It's not the whole truth, I guess, is what I'm trying to say. In that, if you take medication, that helps cover up the symptoms of what's going on, but does not fix the problem. In counseling, we can't always cure you. If you have bipolar, you're going to be bipolar for the rest of your life, and you most likely need medication for that. But you should also be in counseling for that bipolar as well, learning daily coping skills, things to do, because medication is not 100%. It's all about doing what is best for you. If counseling can get you part of the way there, medication can get you part of the way there, just think what both can do. You leading a better, happier, fuller life. And it's not just bipolar, it's depression, learning to cope with it in different ways, learn different things to do for it, getting past it, getting beyond it, and then having that medication to give you that boost. That is, a great thing. A lot of times people come in for counseling, they're overwhelmed. And it may be that, you come into counseling for a month or a week, and, we definitely feel you need to be on medication. And, there's nothing wrong with getting on medication, coming back, a couple weeks later, once you're a little bit stabilized, and we can continue working on the issue with you. So it's not one or the other all the time. It's, what can they do together? How can we help complement it? Taking time out for counseling, again, with the culture of quick, fast, and easy, is not always something some, people want to do, but it can immensely help your life. Counseling, makes you happier, healthier, and I always say wealthier, because it makes you that much better overall. So if, a few hours and a little bit of money invested in counseling can make a huge impact in the rest of your life. So it's a great investment. So as far as medication goes, a lot of people worry about, they've heard this about, medication or that, or it did this to one person. The biggest thing about that is that's why there are 100 different medications at several different dosages. That's why you need to be working with a psychiatrist, hand in hand with us. That's also why I don't recommend going to just your family care doctor, because as well-intentioned as they are, they don't know a whole lot about psych meds. They don't keep up to date on it. I tell clients all the time, if you have a heart problem, you should be seeing a cardiologist. If you have a problem with your foot, you go see a podiatrist. And if you're having mental health issues, you need to be seeing a psychiatrist, someone that specializes in that, so that we can get you, the best medication for you. And that's the whole key, is what works for you, what works the best. And then with counseling, we can take it even further and help you with the rest of your life. So that's a little bit about counseling versus medication. It's not necessarily a one-sided game. Definitely putting them together. Siobhan's asking what a normal session looks like. We're going to cover that here in a couple of weeks. Next week, I know I'm going to hit on what an intake looks like, as far as, what to expect first time coming in and that type of thing. So we appreciate it. If you need anything, you can message us. You can call us at 256-686-9195, luminuscounseling.org. And like I said, even if you don't need counseling, we can be a great resource if you need help. So please reach out if you need help. Thank you.